Hi students, I am Dr. Raghavendra Jayesh, Professor and HOD, Prosthodontics Department. Today we shall discuss agar as it is used in dentistry. Shall we? Agar comes under the classification of hydrocolloids. What do we mean by hydrocolloid? The word hydrocolloid is derived from two different words, hydros and colloid. Hydros means water and colloid means it is a system where one substance is microscopically dispersed uniformly throughout another system. The two phases are called dispersed phase and dispersion phase. The particles which are completely mixed in the system is called dispersed phase, and that particular medium which contains these particles fully embedded or mixed, that is called dispersion phase. Okay. So, the dispersion phase, when it is water, we call it hydrocolloid. What are the general characteristics of these hydrocolloids? They have a sol phase and a gel phase. The sol is the colloidal dispersion of very tiny particles in a continuous liquid medium, while gel means a suspension that behaves like an elastic solid. While we make impression with agar, the material is introduced in the patient's mouth in the sol phase, where it has got sufficient fluidity to record the tissue details. Upon setting, what happens? The sol becomes a gel gradually, and this sol to gel transformation is dependent upon certain conditions which can vary from material to material. In the case of agar, this condition for the sol to become a gel is alteration in temperature. That means the sol phase is introduced in the patient's mouth at a little higher temperature, but that temperature is tolerable by the soft tissues in the mouth. And upon reduction of the temperature, while the material is intraorally present, if we reduce the temperature of the sol, it becomes a gel. The form of supply of agar, how it is done? In preformed gel, it is supplied. Upon heating to 70 degrees centigrade to 96 degrees centigrade, the sol state is obtained. In this sol state, the material has got sufficient flow. But this almost 96 degrees centigrade is too high a temperature for the oral mucosa to tolerate. So, we cannot introduce agar at 96 degrees intraorally. So, what do? We reduce the temperature of agar before introducing the material intraorally. And this process of reducing the temperature of agar from 96 degrees to mouth tolerant temperature is called tempering. That is, reduce the temperature to oral tolerance limit. Agar sets between 37 to 50 degrees C. This temperature range, 37 to 50 degrees Celsius, is called gelation temperature. What about the composition of agar? Agar has 13 to 17% presence in the material, and this ingredient agar helps to form the brush heap structure when the material sets from sol to gel state. Borate 0.2 to 0.5%. This gives strength to the set material. Sulfate between 1 to 2%. Sulfate is the gypsum hardener for the material. Hard wax is incorporated in the material as a filler in the ratio 0.5 to 1%. And we have thixotropic material 0.3 to 0.5%. This helps to thicken the set material. The residual volume is occupied by water, and water is the principal reaction medium. Practical usage of agar. In order to use agar, we cannot simply hand mix the material. We must have a particular equipment called a conditioning unit. This conditioning unit has got 3 compartments. One compartment to liquefy the agar material, the second compartment to store the agar material, and the third one to temper or reduce the high heat of the material. Materials with 2 viscosities are used to make impression. One is called tray agar, the other one is called syringe agar. Obviously, the syringe agar has got less viscosity and more flow, okay? Whereas the tray agar has got more viscosity and comparatively lesser flow. While the syringe agar does not need tempering, the tray agar definitely needs tempering. We see the 3 compartments of the conditioning unit, and this helps us to manipulate agar. How do we prepare agar as the impression material? First, we liquefy agar by heating up to 100 degrees centigrade for 10 minutes. At that time, the preformed gel structure is converted to free flowing sol phase. Then we place the tube in the storage bath at 63 to 65 degree. This is called storage temperature, and this is to retain the sol state. In this temperature range of 63 to 65 degrees centigrade, the sol state is retained in the material, and at the same time it helps to sustain this temperature until the material is kept inside the patient's mouth. Then initially we place the tray after loading the sol in the tempering bath. Then the tempering time is 3 to 10 minutes. At this time, what happens? The temperature reduces from 63 degrees C to 65 degrees C. From this range, it comes to around 45 to 50 degrees centigrade, which is tolerable by the mouth tissues. Making the impression with agar. Syringe material is applied to the prepared teeth. Syringe material has got more flow, so we have to apply the syringe material from near the gingival margin or cervical area. Then we have to proceed to the incisal or occlusal aspect. While doing so, we must avoid air bubble formation. How do we avoid air bubble formation? By maintaining a continuous contact of the tip of the syringe with the tooth surface. If you remove the syringe tip away from the tooth, then again make a recontact with the tooth surface, there are every chances of air bubble entrapment. Then the material with the tray is kept over the prepared teeth in which we have already placed syringe agar, right? Then we have to exert light pressure to retain the tray over the prepared teeth and the tissues. Water in a temperature range of 18 to 21 degrees Celsius is run through the tray. There are channels within this preformed trays through which water at this temperature range can be circulated, and such trays are called water cooled trays. Then this water circulation is done for 3 to 5 minutes. The tray is held firmly until the agar material sets. Hydrocolloid materials exhibit viscoelastic behavior or shear thinning. It is necessary to remove the impression with a single snap rather than trying to tease it out. Any twisting or flexure must be avoided. If properly done, resulting impression will accurately reproduce the dimension and details of hard tissues and soft tissues. Distortion during gelation. Some contraction occurs because of the physical change in the hydrocolloid transformation from a sol to a gel. If the material is held rigidly in the tray, the impression material will shrink towards the center of its mass, thereby creating larger dies. Since the sol is a poor thermal conductor, rapid cooling may cause a concentration of stress near the tray where the gelation takes place initially. Consequently, water at approximately 20 degrees C is more suitable for cooling the impression than ice water. What are the advantages and disadvantages of agar? Advantages: it has got very good flow, the accuracy of tissue details is excellent, and it is a reversible material. Only thing is, when we reuse agar for the second time, we have to heat agar to 96 degrees and sustain that for 3 additional minutes, because it takes a little more time to break the brush heap structure internally. So, this point must be taken care of. Disadvantages: heat from the material can very well cause injury to the soft tissues. Elaborate equipment and more time are needed to use this material. Imbibition and syneresis are two disadvantages of this material. Imbibition means absorption of water and physical increase in dimension. Syneresis means loss of water due to evaporation and subsequent shrinkage. Agar as a hydrocolloid is prone to both these disadvantages. So that means what? As soon as we make impression, we should pour the cast immediately, right? And agar cannot be used for edentulous impression. It is a very good impression material for dentulous cases, not for edentulous mouth. Definitely we need a special type of trays. As I told you, water cooled trays are specifically needed for agar. Then cast must be poured immediately after removal of the impression from the patient's mouth. To summarize, agar can be definitely used as a final impression material in fixed prosthodontics, taking care to minimize certain difficult aspects and to take advantage of its viable good properties. We can use it as a final impression material in fixed partial denture work. So, students, I hope you have got the gist of this material agar, as it is used in fixed prosthodontics as a final impression material to make crowns and bridges. You have any queries, please drop them in the comment box. I will be happy to clarify. Thank you.